Hello everyone, I am Veron. Thanks for joining me for this presentation on my research plan. The institution I will be studying is a public Type C hospital established in 1943 in the parish of Portland, Jamaica. The facility has over 10 departments. However, for this research, I will be focusing on the accident and emergency unit. My research topic is the effects of overcrowding on the accident and emergency unit at ABC Hospital. Now, why is overcrowding an important problem? Overcrowding can have severe effects on the physiological, health, and social well-being of patients and employees. According to French Lindo Williams Johnson 2013, studies show that delay in the emergency department in hospitals is a significant cause of patient discontent. In addition, according to Reid 2014, these conditions exist in Jamaica, as an audit conducted by the Southern Regional Health Authority in May 2015 found that the accident and emergency units needed medications, clothing for staff and patients, cots, stretchers, beds, among other items. This should not be the case, as emergency departments are supplying immediate medical care. What will you find in the literature review? The literature review highlights empirical data from former studies on the effects of overcrowding on the employee and patient health, physiological, and social well-being. The review also highlights the theoretical framework used to guide this research, as well as measures that can be used to alleviate the problem of overcrowding. Firstly, overcrowding poses serious direct and indirect health risk to patients, otherwise from what is stated on the slide. Farmer 2016 says that 12% of all recurring visits to the emergency department were associated with patients receiving unfavorable occurrences on the first visit, which prompted a second visit. Overcrowding contributes to the physiological frustrations due to a lack of privacy, lengthy waiting periods, which in turn influences the behavior and social relations of both patient and employee. Now, Ashley 2014 says moral distress can be very damaging. Nurses may become upset, depressed, and suffer physiological as well as psychological fatigue because of feelings of distress. Now, I am sure that you will agree with me that this will make it even more difficult for the employees to create a safe and welcoming atmosphere for patients. Overcrowding can be a push factor resulting in staffing issues. Do we have a staffing issue here in Jamaica? Of course we do. According to Health Minister Christopher Tufton in 2017, the brain drain of some of our health staff, most notable nurses, has virtually crippled the delivery of certain healthcare services and has had a dramatic effect on the overall quality of healthcare. Now, what thematic framework will I be using to guide this research paper? These are Orlando's nursing process theory and Roy's adaptation theory. Now, Dejovic explains that the trouble of overcrowding often results in long waiting periods for transfers to the ICU. The long waiting period coupled with overcrowding makes it more challenging to examine seriously ill patients accurately and supplying them with the basic assistance. Now, in this case, he's saying that Orlando's theory would assist the nurses in identifying extreme indication of discomfort or need exhibited by the patient till they are moved to the ICU. Why? I am sure you're eager to find out what methodology I'll be using for this research paper. Well, the methodology that I have selected is the mixed method. This methodology is good for conducting research that involves gathering, analyzing, and integrating quantitative and qualitative data in research. Now, I'm sure you'll want to know why I selected this methodology. The integration component gives readers more confidence in the results. Now that I've selected my methodology, how would I go about collecting my data? Well, the primary source of data collection will be from questionnaires and interviews. Two sets of questionnaires will be distributed, one to employees and one to clients. The employees will be selected randomly, and the employee list will be used to select the sample size. Now, half of the population employed in the accident and emergency unit will be selected to participate in the questionnaire. However, before questionnaires are administered, permission will be sought from the management of the above organization. Respondents will be given 2 to 3 days to complete these questionnaires. To ensure that there is equity, both samples will include both males and females. In relation to the interviews will be conducted with 2 senior personnel from the HR department. Now, this will be more purposive sampling, and the interviews will take 15 to 20 minutes. Now, some aspects of the interview will be based on information revealed in the questionnaires. The questions will be basically semi-structured questions.